So for mealtime, I kind of wanted to separate it to be a little bit more by itself because I think it's a really big topic where you have so many different fine motor skills to build because you don't just have picking things up with your hands, but you also have the utensil use. So during meals, children naturally practice reaching, grasping, releasing, scooping, poking, fine motor accuracy, bilateral coordination, all of those skills just by how they typically would eat or engage with mealtime. So when a child reaches for a small piece of food, they kind of develop the hand-eye coordination, open and close hand control, early grasp patterns. They use their visual motor skills with this as well, right, for reaching for that small piece of food. And also it helps to develop their pincer grasp through picking up those small pieces of food. So maybe those Cheerios, the Puffs, anything that's small encourages them to just use those two pincer fingers. It's also great to develop and refine precision, strength, and coordination. So when we're thinking of spoon and fork use, to use your utensils, right, to have accuracy in scooping up your applesauce and bringing it to your mouth, you need to have wrist stability. So it has to be steady as it's coming towards you. You have to have graded force, so good control, right? If I am scooping and I go really, really hard in, my applesauce might splash everywhere, but I have to use some control of being able to scoop it accurately. Motor planning, so coordinating that movement if it's something a little bit newer for us, and that visual motor coordination of where am I going with it. Open cup drinking. This is definitely obviously towards later in this age range, so like more towards toddlers, but strengthening their bilateral coordination, using those two hands together to hold the cup, building your hand and wrist stability, so being stable and accurate, and then also improving that motor control of the force of how we have to bring it to our mouth. Containers and packaging, opening snack containers, peeling bananas, all of that encourages finger isolation, pincer grasp, and hand strength. If I'm going to peel from the top of the banana, right, I have to pinch it and pull it down. If I'm opening a Ziploc, I have to pinch both sides and pull it open. Those all encourages that grasp and the strength as well. So the next topic to get into is play. Play is such a great way to develop fine motor skills. When we're thinking of what a kid does every day, that playing, right? That is their main job. That's what they should be doing all day, every day. So play really supports the progression by giving them repeated motivating opportunities. So reaching, grasping, releasing objects, transferring objects between hands, using both hands together, or manipulating small items, those are all things that happen naturally during play that can help to kind of enforce those fine motor skills. I separated this a little bit by infants and toddlers, so because they do have a little bit of a different play scheme. For infants like 0 to 12 months, play focuses more on exploration and early hand use. So think of reaching and batting at toys. This develops shoulder stability, visual motor coordination, and hand opening. Putting toys or items like within their reach, but where they have to reach out and kind of bat at it or try to grasp at it, all of that kind of encourages those skills. Placing toys at their chest level. I think I briefly mentioned this when we were talking about the diaper changes, but it encourages their hands coming together, transferring toys between hands, and that bilateral coordination as well. And then mouthing and tactile exploration. So this gains sensory feedback. It encourages grip strength and awareness of object properties, which is really important for our fine motor skills. So we can kind of test, okay, this is what this feels like. Okay, I know how to hold this now, stuff like that. So then we have toddlers more in that 1 to 3 year range. So this is where they refine precision and begin more complex manipulation during play. So if we're thinking about how to play with blocks, you need to have a lot of graded force control, hand-eye coordination, wrist stability, pincer grasp refinement for that block play. So stacking them and knocking them down. This is a great way to build those skills. You're encouraging the coordination and the force control of like, okay, do I put this block on really fast or should I do it slow and controlled? Which slow and controlled would probably be the best. Wrist stability, right? If they're unstable, they might knock it down when they don't want to. uh, container and cause and effect, a container and cause and effect play. So putting items in and out of containers encourages that bilateral coordination, motor planning, and hand strength. Um, Containers, you right can put things in, but then you also have to open them to take them out. So that's kind of similar to what we're talking about during mealtime with containers. It's a similar concept, but this is more play based. It also can be cause and effect where if like I put it in and then it's like, oh, where did it go? Right. So if I put it in here, now I know that's where it goes, and now I have to open this to get it out. Pretend play. So using pretend food, dolls, tools, all of that to develop finger isolation, sequencing, problem solving, tool use. Um, Using like the play food. I know we have these here in the office, but the or the clinic, the pretend food with the Velcro between them, right? So you can do so many different fine motor skills with just that one tool. You can rip them apart, you can put them back together. Those are grasping, strength, all of that. And you can also use the tool use, right? The play knife, cutting them open. That helps with sequencing of like how do I motor plan this? How do I do this? Problem solving. If I cut this, it's going to come in two, and the tool use as well. Scribbling and early mark making. So in this 1 to 3 year range, it might be like really new developing skill. They might just start scribbling and it kind of being crazy and all over the place. Or it might start being towards the end, like more specific, like lines and circles and stuff like that. But all scribbling and early mark making with crayons, markers, pencils, they promote that hand strength, the wrist stability, and the development of a mature grasp pattern. When we say mature grasp pattern for like pencil use, that's usually the tripod grasp, like this. Between this age, that shouldn't really develop yet. That comes a little bit later. So next is just when would you seek help, right? So it's important to remember that everything is a range. So just because they hit 9 months and their pincer grasp isn't fully developed yet doesn't mean they're not going to, right? It's a range 9 to 12, 9 to 10. We have time. So in 3 to 4 months range, by that time, if your kiddo's keeping their hands tightly fisted most of the time, they're not really bringing their hands to their mouth so much, they're showing limited arm movement, maybe they don't like tummy time, or they have a difficulty propping themselves up on their forearms briefly, that might be a sign that like, okay, maybe they need a little bit more help with their shoulder strength or their shoulder stability, or being able to move their arms in a reflexive pattern or anything. So then we have by 6 months, difficulty reaching for toys, bringing objects towards their mouth. Maybe they use one hand much more often than the other. By this time, they shouldn't have a dominant hand, but since they don't have a dominant hand, they might use both hands pretty consistently. And if you notice they're just using one, that might be a sign that the other one might be a little bit weaker. They might have or if they have stiff or very loose muscle tone. Muscle tone refers to like how strong and like movable. That's not a great word to describe that, but how much they can move their arm, right? So if they have really stiff muscle tone, their arm might be kind of tight, right? And it's harder to move it. And if it's really loose, it might be a little bit more wiggly and jello-y. By 9 months, they might have difficulty transferring toys between hands, difficulty holding or grasping toys, or keeping hands mostly closed. Might be difficulty weight bearing through arms in supported sitting positions. That might be a sign that they just need a little extra support with building that core strength and stability, and then their fine motor skills. And then by 12 months, that might have more difficulty picking up small pieces of food, difficulty using that pincer grasp, or minimal exploration of toys with their hands. That would also be a sign at that age. Like I said, though, everything is a range. So really, it's not a specific date, oh, they hit 12 months, they're not doing this, right? It's a range, and let's look at the progression, like, of how they move through that hierarchy too, like I said, with the grasp patterns earlier. So then in toddlers 1 to 3 years, so maybe they struggle to hold a spoon and bring it to their mouth in motor planning. Difficulty stacking multiple blocks, 2 to 3 blocks by, I put a range of like 18 to 24 months, but sometime in that range. Has difficulty using both hands together, that bilateral coordination. Avoids manipulating small toys. difficulty engaging with simple dressing tasks. So maybe pushing their arm through the sleeve, pulling up their pants by like 2-ish or 3-ish, frequently dropping items and having difficulty maintaining grasp on them, or seeming a little bit more frustrated during those fine motor tasks. That could indicate that maybe it's really hard for them, so they're feeling frustrated because they aren't successful in it like they want to be. So, why is it beneficial to receive support early? So, research shows that children's brains are most adaptable during the early years. So, early supports can lead to better long term outcomes. It can also alleviate caregiver worry and frustration by providing answers, support, and strategies. It can also help to increase the quality of life for children and their families. And it can curb those maladaptive behaviors so we can learn the right way from the beginning rather than waiting. So, how does OT help? What is occupational therapy and how does it help? So, it uses a whole child approach. You look at their motor skills, their sensory skills, their cognition, their environment, and their motivation. Sorry. We analyze our tasks and find ways to break it down into smaller steps and find the just right challenge for every kid. So, we find what is going to be most helpful for them to build those skills. It's individualized and play based with a heavy focus on the collaboration between the therapist, parent, and the child. So what are our key takeaways today? So development is a range, it's not a race. So we have time and it's a range, it's not a specific date. We want to look out for patterns of delay or progress, not exact age specifications. I'm saying that a lot, I'm sorry. Strong bodies support strong hands. Play is the best practice. Repetition builds skills, and you as a parent are the most important part of the process. They might come to OT to learn these skills, but you're the most important part because you're with them all the time, right? So if you are unsure if your child can benefit from services, we always recommend pursuing an evaluation earlier versus waiting. We don't require referral at Say at all, but we do coordinate care with the child's pediatrician by sending our evaluations of plan of cares to them.